a special guest, Jessica Williams, from the professor here in the nursing department. So she's going to go ahead and talk to you about the LVN and RN program at South Plains College. So she has a lot of really good information for you.
So how many of y'all are interested in nursing? Okay, I'm going to give you these sheets here. You have to touch it because I know you got the. Oh, you didn't. Just so you have something to look at as I'm going through everything. And then y'all can have whatever you want from here. Okay, so again, my name is Jessica Williams, and I am one of the assistant professors there. A couple of hats I wear. I also am the success specialist there, so I specialize in making sure my nursing students are successful, because sometimes we do all of our classes over here and then we go to nursing school and it's like, oh my gosh, I got to study, or I didn't realize that this was so much. And so I kind of help you organize and try to wrap your head around what's needed as far as your study time and testing tips and things like that. So that's another part of a thing that I do. And I'm also I'm the lead on the transition program. And we'll talk about that here in a little bit.
Can you tell a little about how you got started? Or
I was going to tell my story at the end.
Oh,
can I do that?
Yeah.
Okay. And so, because it makes more sense when I go through it all. So I'm homegrown. I'm all South Plains. I mean, I had to go to other schools to be where I'm at, but this is where I started. So this is the best place to start. Okay. And I'm not just saying that because I work here, but it came full circle, right? So for South Plains College Nursing, the main programs that we have for nursing is our vocational nursing program. Okay, and that's your VN program. That's what you'll see, your LVN. Okay, if you're from out of state or whatever, that's LPN for those of you. Okay, and then for VN program, that's it's only 1 year. You have no prerequisites. It's a 48 semester hour credit, so you have to have 48 semester credit hours to complete that entire program. And then you can graduate with a certificate of proficiency, and then you can sit for NCLEX boards for your LVN license. Okay, so you'll be working as an LVN license. And so I will tell you what the job description of an LVN license is. As we move further on, but it will be different in different states. Okay, so if you know somebody who's in another state who has an LVN or LPN, and they're like, well, we're only allowed to do these things. Well, in Texas, we actually do a lot of work as an LVN. So, and then our other degree track that we have is our associate degree nursing program. That's our generic student track. So you'll start 1st through 4th. Okay. And so this is a 2-year program. You do have prerequisites. There are 60 semester credit hours. And then with that, again, you'll graduate with your Associate of Applied Science degree, and then you'll be able to sit for boards for your NCLEX. And then, of course, you'll get your RN license. So for an associate degree program, our campus obviously here is the only one we have for our ADN program. Okay. And it's just right down the street. Right, there's that little building there. It was the old Walmart, right? It was the old Walmart. Yeah, and so, but yeah, we have a huge facility. We do share it with PT, so with physical therapy students. But yeah, and soon enough, we're going to be sharing it with a whole nother group of people. So I'm excited with that. So school hours are Monday through Friday. Hours will vary, okay, due to clinical. And due to class. Okay, some days you may be there all day, some days you may not. Okay, and so, but every semester, the instructors will set out a schedule and calendar so you can look at that and be able to work or do whatever you got to do with that schedule. So when it comes to admissions requirements, okay, the biggest thing is making sure that you're obviously a part of South Plains College. And then of course you'll go get your admissions packet. Okay. You can go to Joe Fowler at the building, and she will give you an admissions packet. And with that, you'll have to make sure that you are TSI compliant. Okay, making sure that you're that. Also, you'll have to complete a TEAS test. Okay, you have to complete a TEAS test, and you have to make a minimum score with reading, English, and math of a 58.7. Okay, that's also on your little paper, right? And so with science, we want a minimum score of 50. That will just give you extra points because we kind of go off a point grid to say, hey, these students have made this amount of points, and we kind of put you on a point grid, right? And the highest points obviously will be looked at for admissions. Okay. So I would still want to do well on science, just so you know. Okay. And then of course for a cumulative GPA, you need to have a 2.5 or better. And for a prerequisite, right, because we only look at our prerequisites, which will be your A&P 1 and 2 and your English, your prerequisites needs to be a 2.7. Okay, so you need to make sure you look at that, right? So we look at those things. So if you're taking A&P and you made a B and a C, that's okay on A&P 1 and 2. But if you made 2 C's with A&P 1 and 2, we're probably going to ask you, hey, you probably need to retake one of those and make a B or better. Okay, because that's another thing that we look at. A&P, guys, is very important. Okay, and you got to take it seriously when you're taking it here, right? Don't just take it to pass. Because we expect you to retain a lot of that information because it's the building block. All right, it's a building block. Because the second that you come in the first semester, we're already doing farm. We're doing range of motion, so you need to know how the muscles work, those types of things. Okay, we're doing pharmacology, like I just said, and you got to know how that medication is working in that body and what part of the cell, and all the types of things. Okay, and so that's very important. That A&P 1 and 2. So, and again, that has to be within 5 years, right? It's a bummer when it's past the 5 years. Believe me, I've been there. I've been there twice where it was past, but I'm pretty old. So it was when 5 years passed a couple of times for me. Also, we want to make sure you're CPR certified. If you get in and you're not CPR certified, it's fine because I'm also a CPR instructor for our program, and so we will get that done for you. Okay, first thing, right after orientation, then we're going to do CPR. We'll get you certified. Okay, and so that right there isn't too big of a deal to have done before admissions. Again, once you complete, the biggest thing we really want to focus back on is you're going to get that associate degree, because not a lot of RN programs here provide an associate degree, so you got to make sure you look at that too. Okay, because I know there's other programs that provide an RN, right, to be able to sit on NCLEX to get an RN license, but not all of them provide a degree. Okay, so you need to make sure you look into that. We are the only one here in this area that provide an associate degree. Okay, and then of course you qualify for NCLEX licensure, and then you get your RN license. All right, so again, what do registered nurses do? Guys, there's a lot of things we can do. Okay, we can work in all areas such as emergency rooms, intensive care units, because those are the places that people like to go, labor and delivery, okay, where we're having babies, all the things, okay, you got 2 patients there. We can work in clinics, home health, hospice, case management. You can be a charge nurse, nurse supervisor, nurse educator, and that's my role right now, director of nurses. So it goes higher and higher. You can be an entrepreneur nurse, right? Building your own coaching business or wellness business. There's those types of things. You can be a travel nurse and go to all the different areas. Okay. I just recently had a graduate purchase an RV because he's a travel nurse and he goes all over the United States, right? Doing the nursing thing. He did his 1 year in med-surg. And he went on, because with med-surg on that hospital floor, you can do a lot of things, get a lot of experience. And then he went on and became a travel nurse. So there's all kinds of things. Vocational nursing program, okay? So again, with our vocational nursing program, that is that 1 year program, right? Just 1 year. Okay. We do have 3 separate campuses for this. We have Levelland, Plainview, and Reese. Okay. And then, so again, with those hours, Monday through Friday, all those vary between classroom and clinical. Everybody's different. So this one up here is obviously our Levelland. This one's our Plainview, and this one is Building 8 at the Reese Center. Okay. And so that's where you would be, and that's the one that's out in Lubbock, the Reese Center. Okay. So I love this program. This is where I came from. So with vocational nursing program, your admissions requirements, again, you need to have your GED. You will have to do the TEAS test, 58.7, okay? Reading, math, and English, and then science, you can score a 40 or above, okay? And again, they do the point system as well, right? Remember I talked about that point system? Where all the things that you do will give you a point. If you're a CNA, we'll give you a point, okay? So if you have CNA experience, make sure you have your CNA license and all that, and we'll give you points for that as well, okay? Or any type of hospital experience. Make sure you add that in there. We'll give you some points for that. TSI compliant, of course, 2.0 GPA, CPR certification. I did the same thing for them, for my LVNs that come in. So if you have it, that's great. If not, we'll get you there. And then with completion, I had the 80, and I apologize for the LVN program. We do have the certificate of proficiency, okay? So you'll get a certificate, not the actual degree, but still good, right? And then you'll qualify to test for NCLEX, and then you'll get your LVN license. So a little bit of what an LVN can do, okay? We can pretty much work anywhere, again, here in Lubbock, but we have to work within a different scope than the RN, okay? So the RN is more of our supervisor, and there are certain things that we can't do without the RN, okay? And then of course we work with the RN, okay? But with our LVN license, we can do some supervision, okay? With our hospital, we can work in pretty much all the main floors like med-surg, renal, some oncology, and then pediatrics. We can do a lot of clinic, okay? So a lot of your clinician nurses are LVNs or MAs, but most of them are LVNs. Home health, rural hospitals, hospice, nursing homes. So we can pretty much do everything. There's certain areas like, like at the nursing homes where LVNs can be a director. Okay, so there's movement there. Also, LVNs can travel too. Okay, so LVNs can also be travel nurses, but again, you got to be careful of those states. Remember I told you? Okay, so you want to make sure that you're careful with your scope of practice in the different states. All right, and so with the ADN and LVN track, if you go LVN, okay, if you go LVN or if you're a paramedic, we are starting a new program in the fall. Okay, and with this program here, like I said, you can be a paramedic or an LVN, and you can get your ADN. Okay, you can get your ADN. So with this here, again, it's only here at the Levelland campus. The hours do vary. Okay, with this particular program, we have 65% in person, so it's not 100% in person like the other programs. Okay, it's not 100%. Here we have 65% in person, and we have 35% hybrid. Okay, what does hybrid mean? Right, hybrid means it's part of it's online. Okay, so you do a lot of didactic work online, and then you'll do some in person. Okay, granted, we have to have a lot of it in person for now because we're starting out, so we want to see how it goes. Okay, and then we'll look at those things. But yes, and then also you have to think about the skills that we have to recheck off and all those things to make sure everybody's up to par with their skills being in practice. Okay, and so this will have 3 consecutive semesters. So you'll start in August and then you'll end in August. Okay, and it's just 3 semesters. And also at the end of this, you'll have 60 semester credit courses. Okay, right? Or hours, credit hours, okay? So you'll still end with your ADN. So with this one here, there are some things that are added to this. You would have to have admission here for SPC. For your prerequisites, we want to make sure you have your English 1301, your AAP 1 and 2, your psych, or your psychology 1314, and then a humanities course. Okay? You still have to be TSI compliant, and you still have to take the T's with all the regular requirements as before with that 58.7, right? In addition to these, right? In addition to these other tests, we did add a critical thinking assessment because we want to see where your critical thinking's at. Okay, that's to help me know how I need to teach you. Okay, I have to, because I need to know by your experience, what things have you experienced that lets me know that you have good critical thinking and good critical judgment. And then wherever you're weak, I'm going to help build you up with that. We all going to help build you up with that. Okay. And so that's just what this is for. So we want to make sure that you hopefully can score for 50% or above. This doesn't hurt you, but it will add points on that point system if you make it 50% or more. Okay. If you make it 50% or higher on that critical thinking assessment. Your GPA, it needs to be a 2.57. So that is a difference between the ADN program. And then your prerequisites need to still be at a 2.7. Okay, so make sure those prerequisites are pretty important. Make sure you're busting out some A's and B's on there. Okay. All non-science prerequisites, we want them to be at least a C or a better. And then we also want to make sure you've at least had 1 year of working experience as a paramedic, as a licensed paramedic and a licensed LVN. Okay. That's not adding the time that you took as a CNA to get to that LVN license. And you have to be LVN licensed and working for that 1 year, or paramedic license working for a full year before you can go ahead and be admitted. Okay. And we're going to look at that too. Right. And of course, at the end, you're getting your associate's degree of applied nursing. You'll qualify to sit for NCLEX, and then you'll get your RN license. Okay. So that's the new thing that's going on for next semester. So we have, just to recap, we have all these, different ways that you can be a nurse. If nursing is your goal, there's all different kinds of ways to get to this goal. Okay. And so you can do it the generic way, which is start in at the first semester, going all the way through the fourth semester. You have LVN. Okay, you do that 1 year, then you can come back and you can do your LVN to RN. Okay, you can come back and do that, and you get your RN. All right. So a little bit about myself. Okay, I'm gonna give you a little story now that I've kind of told you how everything works. So I'm ex-military. The very first thing I want to do was just be a nurse, right? And I thought I could just come in and do it, right? So I did come here and I did all my prerequisites. This is what I'm telling you. Prerequisites is so important, okay? Because I failed my prerequisites at the very beginning because I didn't realize how hard this was going to be for me coming out of the military, right? And so granted, it kind of took that little bit, but that hurt me. So that's what I'm telling you. You got to make sure that you're very careful with taking these prerequisites and that you're really serious on it, okay? And that you're really studying and staying on top of it, right? Okay, so I took all my prerequisites, right? My main goal was to be an RN. That was my end goal, okay? Is I wanted to be a registered nurse. And so I took all my prerequisites. And then I applied for all the things. I applied for RN Covenant. I applied for RN here. I applied for LVN because I was like, I got to get started. I got to do something with my life. Right. And so I actually didn't get in South Plains College ADN program the first time, and I didn't get into Covenant. Okay. And so but I actually got into LVN. Right. So I did that first year of LVN. It was great. I had a great experience personally. And so I actually got offered a job before I even graduated. Right. So on the day of graduation, we graduated on a Saturday. I was ready to start work on a Monday. Right. Orientation. It was great. It was exciting. I mean, I was excited. I was happy because that floor that I actually started working on, I was doing clinicals on. And I love the floor. I love the flow. I got to know the nurses and stuff. And they're like, hey, you want to work here when you're done? And I was like, ooh, I don't know. I don't know where I want to be. Right? I was like, I got scared. I was like, why? And they're like, well, we have a position and we'll hold it for you if you want it. And I was like, okay. And sure enough, like I said, I got in and like I was telling my students, anytime you go to clinical, I mean, they're looking at you, right? They know I want this person on my floor. I want them to work with me. Anyway, so I did that and I was like, I still want this RN. I still want this RN, right? I want to be a registered nurse. And so right after I started working, I was like, I'm going to go ahead and apply for RN again. So I put my application in again, right? And I got pregnant. And so I was like, okay, I'm going to wait. So I waited, right? I waited for about 4.5 years exactly. And then for my son to kind of grow up a little bit. And so I went ahead and reapplied. And at that time, my stuff lapsed. And I was like, oh my gosh. So I had to retake all these things, right? I had to retake everything for Covenant. I retook everything for South Plains College. Okay, because a lot of my stuff lapsed for that 5 years. I told you that 5 years is going to get you if you don't stay on top of it. And so I reapplied, and I applied for both schools, and so I got in at South Plains College. Came back here for the LVN to RN transition program, and went all the way through it and got done and got my ADN, right? Got my ADN, and I started back on the floor as a registered nurse. I passed my NCLEX the first time because that's what you want to do. That's your mindset. I want you to think one and done when it comes to that NCLEX. So I want to pass it the first time and be done with it. And so I did that, and then I went to LCU, got my BSN. And then I went to GCU, which is Grand Canyon University, and I got my master's. And I do plan on the future to get my doctorate, but I have to wait for everybody else to do their stuff first, right? But that's the luxury of being a nurse, okay? I've worked in med-surg, right? I've worked in wound care, okay? I did cardiac telemetry. I did cardiac during my whole season. I did cardiac clinical and cardiovascular at Texas Tech Health Science Center. Okay, I did pediatric at Texas Tech Health Science Center. I did OB for a little bit at Texas because I was like, that was not out of my comfort zone. But I was like, I'm going to try it. I'm a nurse. I know things. But I was like, no, right? Each to their own. That's the luxury of being a nurse, guys. You can go anywhere. You can do all that, and the thing is, you're pouring into people and you're caring for. You're doing the same thing, right? And so then after that, I got the call to be a teacher. One of my old teachers in LVN was retiring, and she remembered me and said, "Hey, I would love for you to come and interview to see if we can get you hired." I was like, "Okay. You don't remember me as a student?" Because I remember myself. But yeah, and then that's how I got hired on. I started working at the LVN program, right? Did that for 3 years, and then now I moved over here to the RN program. Taught for first semester for about 2 years, then got switched to my new position with transition because I love transition, man. I love my LVNs. I do. I love my LVNs moving, and because I know the struggle, I know the life, right? So I know what they're trying to do, and that's kind of where I'm at right now. And now another part of my life is to recruit, to get people, come on, be a nurse, it's okay, But other than that, that's my story. That's how I got here, right? And then my direction and my journey is different from everybody else's journey, okay? And it's going to be different from your journey. But my goal, again, was to be that RN, and I still got there, right? And it was all due to South Plains College. So, all right, so I have a little ditty if it will play. I don't know. Oh, it will. Do you have the sound on this thing?
They should, yes. You might have to just,
Oh, it's going. Sorry.
music.
Yeah, there's just a little music in there. Oh, so good. There you go. That's all I can hear. Okay. Students, some of our past students, this is one of my transition groups. We do simulation, right? We do a lot of simulation to kind of help y'all. I know with the mannequins, they creep me out more than patients. I mean, but it is but that's how we learn, right? We have our own association, okay, for nursing. We have TNSA, and then we also have NSNA. We have students right now that are up on the national level from our school that are representing our school at the national level for nursing students. So we're so proud of them right now. We do a lot of outreach types of things. We do a lot of things to get prepared. That's our motto, one and done. When you walk in, you'll see that sign, okay? We do a Baptist student ministry, takes us to El Paso, to clinics, and we do a mission trip. We did one in December where we went to El Paso, we did a mission trip. We took a lot of the students, we took PT students and nursing students to go do that. So it was a good time. Yeah, and we helped the community. We were helping them with, of course, all their intake. We sat in with the nurse practitioners and helped the nurse practitioners and the doctors. Oh, and they feed us. That was the best part. We also do the Dream Center. They're in Lubbock. Okay, there is a health check clinic that they do every Saturday. We help do those clinics, and then we also help with like bagging groceries for the individuals. We do the closet, wherever they need us, we're there for them. So we have that every third Saturday of the month. So a lot of our students just go out there and volunteer. And a lot of classes actually give extra points for that. You'll just learn a lot of your skills through us. Okay. We use evidence-based practice to make sure that you're getting the correct skill and that we're teaching you the correct way so you're ready for the hospital. And we reward you. Those are my students that got the first stick on their IV day. We have to stick each other, just so you know. Sometimes we play in our simulation. All right, and that's it. Thank y'all so much for listening. Does anybody have any questions? Questions, concerns?
I have one here on the transition one. Where it says minimum cumulative, is it 2 it just says minimum cumulative and prerequisite is 2.7, but on there it's 2.7.
Okay, I will have to look at that, but this one is the newer one.
Yeah. On there it's a different.
Okay, yeah, so I would take what it says, yeah, 2.9. Thank you.
Where do you get the documents?
You actually go to our office here. You can go online and print them out, or you can go to our office here and go to the two front ladies, Tammy or Jill, and they'll actually print that off for you. Or they'll have actually a whole packet, just, here you go.
For the,
Like a day, like how many classes do you take during the day?
During the day, you'll just do one at a time. Yes. Yes, yeah. So you have, so in first semester, because I'm actually helping with first right now, you have foundations, you have farm, skills, and clinicals. Okay. And so right now they're already done with their skills, so they're done with that. And so they're teaching farm and foundations, but each day it's something different. Like I think they do farm on Tuesdays and Thursdays, and they do foundations on Mondays and Wednesdays. And then Fridays they use it for check off, or the students can come in and check off their skills. So you have to actually do a full check off on everything, where we watch you, or we'll actually record you on how you check off on your skill. And so those are those Fridays that you can use that. You come in at your own time, do your skill, and then you can leave for the day.
Would it be like that for LVN too?
LVN, yes, for sure, LVN. And then, of course, you have your days that you go to clinical too. So LVN usually used to go to clinical Monday, Tuesday, Wednesday. I don't know if they changed it since, because I haven't been there in a while. But I think Monday, Tuesday, Wednesday, they go to clinicals. For first semester, we go to clinicals Mondays and Wednesdays. And then in second semester, it changes to second semester, I think there are 4 changes to Thursdays and Fridays.
Great questions. If we can go ahead and do your evaluation, and we're gonna go ahead and do a door prize, but she's gonna be here. If you have any other questions,
Yeah.
stick around for a little bit. Come by and talk to her. So the winner of our door prize